Hello, my name is Robert Cunningham. I have a master's degree in counseling education, counseling psychology from Western Michigan University. I also have a certificate in holistic health as well as substance abuse. Today, I want to talk to you about trauma, trauma before and during incarceration. Trauma is something that it lingers with you. Trauma is something that is compounded after each and every trauma. So trauma is not something that will go away easily. There's ways you can get around it and ways you can de-escalate it. But trauma is something that usually will stay with people for long periods of time, especially when they don't get any type of help or treatment for trauma. Trauma during incarceration as well as trauma before incarceration. Trauma a lot of times happen with these people or with this group before incarceration and maybe starts during childhood. I've done groups with young women as well as young men, and I've found that a lot of times the women, they explain to me that trauma started at a young age. It was maybe through sexual abuse, maybe physical abuse, but it started when they were maybe adolescent age, and then they got off into the use of some type of drug to suppress the memories or to suppress the pain. So trauma was something that started at a young age and carried on through to adulthood and even led them to prison. Because when you look at trauma, when you look at the criminal cycle, when you look at addiction, it all falls in together. The alcohol and drug use would usually lead to a criminal behavior. The criminal behavior will lead to incarceration, whether it be the county jail and or some type of penal institution with the state. So we have to look at this in a realistic view, that it is something that happens usually at a young age. It is something that lingers with us. It is something that is imprinted in one's brain. So a lot of times when you find people that have been traumatized, when you find people that are on substance abuse, you will notice that in their brain, they have a small portion of their brain that does not function as far as planning or detailing things out or strategizing things in life. They have a lack thereof. And these are some of the things that I've noticed through me dealing with these men and women for the last 20 years. I would say that a lot of them, if they had gotten help or gotten some type of treatment, they would have been a lot better off. Or maybe some of them would have even avoided, trouble with the law. So as we talk about this, this trauma, these are things that we have to really look at and understand that these people or persons are hurt and they're wounded and they need to be healed. Now, there's always a spiritual side to this. And a lot of times, people, they don't want to add that to the cycle, but there's a spiritual way, there's a spiritual solution. So it's all part of the equation. We have to look at how these men or women, when they are released from prison, they look for housing. We find that there's barriers that are set up for people that are coming from prison. Some of them may have drug cases. They can't get food stamps. Some of them may even have criminal sexual charges, so they can't get housings in certain locations. So these are all barriers that they're gonna face when they come home. Some of them come out with a lack of support of family. I suggest that anyone that that you may have as part of your family, try to support them. Try to be there for them. Try to understand them. Because a lot of these men are hurting men. When they leave out of prison, they have been traumatized before going as well as traumatizing after they get there. And remember this one thing. When a person go into an incarcerated situation, when he comes out, he's a different person. He has been changed. The environment forced him to change. The environment forced him to learn things that he maybe did not know. He has to unlearn some things that he learned once he come home. The addiction might want to kick back in, so you have to be careful. from the stress and from the frustration. A lot of times these men can't get jobs, so they become frustrated. And the first thing they want to do is go back to their old habits or their old ways or their old criminal behavior. So these are the things that are barriers for these men. When you start talking about work or employment, some of these men have no skills. In fact, there's a statistic that says 60% of prisoners are functionally illiterate. Now, those are some things that we need to tap into and help improve. Make sure that they become more educated. Make sure that they might even learn skilled trades, things that they can use so they can actually come out and function in society as normal people. So returning back to the old environment will hinder them. They go back to the neighborhood. They go back to their old friends. They go back to that old environment. And a lot of times the trouble is just laying there waiting on them. So these are some of the barriers that we have to look at to help the returning citizens overcome. The heavy court costs, the heavy court fines. A lot of them return home and they owe thousands of dollars. Well, they have to pay this money or they won't be able to get off of parole or / probation. They have to pay that cost. But if you don't have a job, how are you going to repay a cost? How are you going to repay a fine when you're not working? So that brings on a lot of stress. So now we're talking about co-occurring mental illnesses going along with the substance abuse use, whether it's depression, anxiety, frustration. These are mental health issues that these men will deal with. Then it will be compounded with the trauma. Then it can be compounded with the drug use if they choose to return back to the use of drugs, whether it be the methamphetamine or the crack cocaine or the opiate addiction, whatever it might be. These men are struggling to survive. They're struggling to make things happen for them. And with a lack of support, a lot of times the men, they become frustrated and they give up. And we're here to talk about what needs to be done. These are some of the things that need to be done. They need a good, healthy support system, whether it's through community organizations, whether it's through community churches, whether it's through life coaching, whether it's through therapeutic counseling. These men need help. There's things that they need to learn about how to apply for jobs. A lot of these men have never held jobs. A lot of these men haven't worked in years. Things have changed now. They need to learn how to fill out resumes. They need to learn how to talk to people and to present themselves. They need to learn how to go and speak with good diction so they can, can express themselves well. These are some of the things that they need to talk about. A lot of times they are looking for jobs, and if you don't give them a second chance, then they give up. After a while, they just become depressed and just say, oh, what the heck? Things are always going to be like this, so I might as well give up. I might as well return back to my old ways. I might as well return back to my old criminal behavior. And these are the things that we must try to break. We need to try to break that cycle of alcohol and drug use that leads to criminal behavior, and the criminal behavior leads them back to incarceration. And we need to figure out what the problem is so we can break that vicious cycle. Because if they don't, then they will find themselves going back to prison, out for a while, back to prison. So that criminal alcohol and drug use that cycle needs to be broken. And that's what we're talking about today. Society is kind of harsh sometimes with these men. They say, well, if you can't do the time, don't do the crime, and things like that. It's easy for them to say that when you're sitting in your living room and you're working and you're living pretty good and your family's okay. But a lot of times these men come from dysfunctional homes. These men come from situations that are not so, for lack of a better word, not so nice. So they've learned to survive by any means necessary. So these are the things that we need to talk about when we start talking about the addiction problem. They need more therapeutic help. They need to be treated. Addiction isn't a disease, so it must be treated as a disease. If I have a cold, then I would go to the doctor and say, hey, I have a cold. These are my symptoms. And when the doctor prescribes me a certain medication and I take it, it will help my cold. Same thing with addiction. They need to be prescribed treatment. This group counseling, intensive counseling, whatever it might be, group counseling, individual counseling. They need help, and we need to understand what they're going through, and we need to offer that help for these men so they can turn their lives around. You always remember, because a person makes a mistake, he shouldn't pay for the rest of his life. If the person is addicted to a drug, he shouldn't have to pay for that for the rest of his life. He can overcome that. So as we talk about the substance abuse disorders, the mental health disorders, they both can be treated. And we have to understand that that's what we need to do. We need to reach out to these people, help them understand what their problems are, and then help them work through some type of action plan. A lot of times the men, they don't understand what their problems are. But if you don't understand what your problem are, you can't solve it. Otherwise, you got to first understand what your problem is before you can solve your problem. You understand what your problem is, then you can come up with solutions. And as a counselor, that's what we're here to do, to help them understand what their problems are so we can help them overcome it. So again, I say to you that the support is very important for these men. The treatment is very important for these men. And if we show compassion, if we show a concern, if we show love, a lot of times that's what they're looking for. A lot of these men have never been shown or felt real love. A lot of women have not felt real love, and they look for it in the wrong places. But if we can show them that there's a better way, if we can show them that they can change their lives, if we can show them that they can turn things around, become productive citizens, that's what we're here to do. I thank you.